Call our meeting to order. I have it 6:30. We just want to say we'd like to welcome each and every one of you. At this time, I'm going to ask Mr. Richard Jones if he would lead us in a word of invocation.
We're unable to hear him, Brother Ricky.
Okay. Mr. Richard?
Yes, sir.
Okay.
Ready. Sorry.
Would you pray again?
Yes, sir. Yes, sir.
We weren't able to hear you. Bible says
sorry
pray
about
without
that.
ceasing. That's all right. If you would. Go
Dear
ahead.
God, we come before you this day in all humbleness. Lord, and please, Lord, we love you. We love your mercy. Lord, and thank you for your wisdom and love. And God, please bless this council in a way that we can serve our members and be pleasing to you. Lord, God bless. Please bless this Lumbee Tribal Council. And God bless the 50,000 plus Lumbee members. Amen.
Amen. Thank you, Mr. Richard. At this time, I would call upon Mr. Carrington Locklear to lead us, if he would take and say our Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Mr. Carrington. And let me say also to those that may be joining up with us, if you would just place your phone on mute until it was time for you to speak, that way we won't have any interference and we'll just show respect for those that are actually speaking. So again, thank you, Mr. Carrington. At this time, I would call upon Ms. Chakawana Oxendine. She would read our preamble to the Tribal Constitution.
Yes, sir, Mr. Ricky. In accordance with the inherent power of self-governance of the Lumbee Tribe of North Carolina, the tribe adopts this Constitution for the purposes of establishing a tribal government structure, preserving for all time the Lumbee way of life and community, promoting the educational, cultural, social, and economic well-being of Lumbee people, and securing justice and freedom for the Lumbee people.
Thank you, ma'am. I appreciate that. Ms. Sharon Hunt, are you with us tonight? Are you able to do the roll call?
Speaker, she is not. She asked if I could do it.
Yes, ma'am. Go ahead. I appreciate that. Thank you, Ms. Belinda.
Ms. Carveckas Barfield.
Here.
Ms. Sharon Hunt.
Here.
Mr. Joel Goolsby.
Here.
Mr. Harold Smith.
Here.
Ms. Pam Hunt.
Here.
Mr. Ted Waddell.
Here.
Ms. Wendy Moore.
Here.
Mr. Carrington Locklear.
Here.
Mr. Larry Chavis.
Here.
Mr. Richard Jones.
Here.
Mr. Reginald Oxendine.
Here.
Miss Yvonne Dow.
Here.
Mr. Alvin Mercer.
Here.
Mr. Corbin Eddings.
Here.
Mr. Joey McNeil.
Here.
Miss Marshall Locklear.
Here.
Miss Chuckawana Oxendine.
Here.
Mr. Shelley Strickland.
Here.
Miss Annie Taylor. Miss Annie Taylor. Mr. Ricky Burnett.
Here.
Mr. Terry Hunt.
Here.
Speaker, you have a quorum.
Thank you,
Mr.
Ms.
Speaker.
Belinda.
Mr. Speaker,
Ms. Pam.
I'd like to offer a motion that we excuse Ms. Sharon Hunt tonight due to illness.
I'll second that.
That motion.
You have a motion by Ms. Pam to excuse Ms. Sharon, second by Mr. Gerald Gooseby. Is there any opposition to that? Hearing none, motion carries. Thank you, Ms. Pam.
Mr. Speaker.
Speaker,
Mr. Corbett?
Yes, sir. I apologize for the interruption. I just wanted to make everyone aware Miss Annie is logged on. I believe she was on mute earlier.
Okay.
Yeah, I'm here.
Okay. Thank you, Miss Annie. Miss Belinda, were you trying to get my attention?
Yes, sir. Miss Sharon is on. She's
Okay.
just very short-winded. She is on.
Okay.
She just wanted to let everybody know she is on. She's just not able to speak.
Good. I'm glad she's able to be with us tonight, Miss Sharon. We hope you get a whole lot better. We have you in our prayers. So at this time, I will read our ethics statement. In accordance with the Ethics and Conflict of Interest Ordinance 2010-0312-01, it is the duty of every council member to avoid both conflicts of interest and the appearances of a conflict of interest with regards to any matters before the council today. Does any council member have a known conflict of interest or any perceived conflicts of interest with respect to any matters coming before the council today? If so, please refrain from participation in those particular deliberations during the meeting. All right. Let me say we welcome all our council members tonight and those also from our Indian community in participation with us tonight on our tribal council meeting. Would also recognize that we have our chairman, Chairman Godwin, is in with us. And also it is an honor we have Mr. Ben Money, who will be speaking to us in a few minutes. We're so glad to have him also. And if there's any other previous council members or any dignitaries, we truly welcome you also and thank you for being a part of us tonight. So at this time, could we review and approve of our agenda for tonight?
Mr. Speaker,
Ms. Pam.
I'll offer a motion that we approve tonight's agenda as presented.
Mr. Speaker.
Who?
Larry Chavis.
Mr. Chavis?
I'll second that motion.
Okay, you have a motion by Ms. Sam and a second from Mr. Larry Chavis. Is there any opposition to this? Hearing none, motion carries. At this time, we would review and approve our January Tribal Council minutes and actions. If I can get a motion.
Mr. Speaker,
Mr. Hunt.
I make a motion we approve the January Tribal Council meeting.
And I second, Mr.
Okay, have a motion by Mr. Terry Hunt, second by Ms. Annie also. So is there any opposition to this motion? Hearing none, motion carried. Could I draw your attention now? Review and approval of the February special call minutes and actions that we took place.
Mr. Speaker.
Mr. Hunt?
I make a motion that we approve February's special call minutes.
And I also second, Mr. Ricky.
Okay, have a motion by Mr. Terry Hunt, second by Ms. Annie Taylor. Is there any opposition? Hearing none, motion carried. And let me go back. I want to say also it is an honor to have with us, participating with us on our meeting tonight, Dr. Mary Ann Jacobs from the University of Pembroke, who is the teacher of our American Indian Studies. And if I'm not mistaken, she also has some of her students that are participating also on this meeting tonight to see as how we as Lumbee, how we conduct our business and things that are going on. So let me say, Dr. Jacobs, we truly welcome you being a part of us tonight.
Thank you so much, Mr. Speaker.
At this time, we have a presentation, and it is my honor to introduce to us Mr. Ben Money, the Deputy Secretary of the North Carolina Department of Health and Human Services, who's come to speak to us tonight for a while as far as what COVID and the vaccine and things that are going on. And I know he's been reaching out to some of the other tribes, so it is just so good that we have him participating with us tonight. So, Mr. Money, if you would.
Thank you so much, Speaker Burnett. I really do appreciate the opportunity to be here. May I please share my screen?
Yes, sir.
Okay, I just have a brief presentation I'd like to give, and then take the time to answer any of the questions you may have.
Okay, thank you, sir.
Okay, can you all see my screen? Okay.
Yes, sir.
All right, let me move something out of the way here. All right, make it a little bit bigger. I really do appreciate the attention that you all have been given to COVID with all the work you've done around prevention, testing, and now the vaccines. And I've got to tell you, of all the logos that I've seen around COVID-19 vaccinations and really the slogans, yours is my favorite. This shot is your shield. I love it. I love it. Thank you so much for doing that.
Thank you.
Now, I want to say also that we are in a better place than we have been in a couple of months in terms of COVID-19, and that really applies to all demographics of our state. We're seeing the case rates that are declining. Our testing still remains high. It's declined somewhat, but it's still giving us enough indication of where COVID-19 is in North Carolina. And a lot of the work is a result of folks really abiding by, our guidance around wearing face coverings, maintaining that physical distance, 6 feet or more apart, and, washing our hands very frequently, being very mindful of the fact that COVID-19 is a deadly virus. But we're happy to see the case rates going down. And you can see the rate for American Indians, which is that light blue bar, which actually was spiked right after the Christmas holidays and has come down. So we're happy to see that. Know that there's been a tremendous impact on families, on your community from COVID-19. And our hearts and our prayers are with you during this time. I will say that we do have some concern about the variants that are in the United States and really around the world. There's 3 main variants that we're concerned about right now. The first one is the one that's called the UK variant, or B117. We know that this one spreads more easily, and it's predicted that this is going to be the main variant of COVID-19 this spring. Another variant we're concerned about is the South African variant, the B1351 variant. There's some concern about that variant in how it will impact the effectiveness of vaccines, and that's still yet to be determined. And then there's also a variant from Brazil. There's one from California. This virus does what viruses do. They mutate. They change, they adapt. And when they don't find a host that they can infect, they tend to change. And so it's just like with the flu, every year, there's a new strain of the flu virus that goes around with COVID. We're expecting that there'll be continued strains. We don't know what that means on an annual basis for vaccinations. We suspect that there will need to be a booster shot that will need to be developed that will take into account new strains. Because this is a coronavirus, which is related to the common cold, actually. We know that there's some seasonality to it, that, as the months get colder, there's more likely to be more coronavirus, that is transmitted. We certainly saw that this year. We saw our cases go up over the winter. And it also means that we really need to continue our efforts around prevention, but also our vaccination efforts. So the thing that we are still yet to determine is, how widely these variants spread. So our state lab actually takes samples every day and sends them down to the Centers for Disease Control for analysis. They actually do gene sequencing of it to determine what type of virus it is. And from there, they can determine which variant it is. And so, we've seen the UK variant in North Carolina. We've seen also a couple of cases of the South African variant. The thing that we don't know we're learning from what happened in England, the UK, is that it does tend to spread more rapidly person to person. We know the UK variant is still not, the vaccine actually works on the UK variant, I should say. It's effective. It prevents the transmission of the virus from one person to the other. So it helps in terms of people being protected from getting COVID-19. We also know that when the UK got their variant, it was actually before they started vaccination, and it was right around the holiday season. So they saw a tremendous spike in cases and hospitalizations. For us right now, we're coming out of that spike that we had. Our hospitalization rates are going down, our case numbers are going down, but we are concerned that if the UK variant or the South African variant comes, we want to know more about how effective our treatments are, as well as, particularly with the South African variant, how effective the vaccines are. We think that based on what we've seen, that there is some lowering of the protection for the South African variant, but for the UK variant, still strong. So what that means is that, as I said before, really being very mindful of the things we've been doing to keep ourselves safe, wearing face coverings, really avoiding being in contact with people that you don't live with, people that are in your household, really limiting that contact with other people unless you absolutely have to go out for things like essential goods and food. And also realize that testing is still an important strategy. So if you feel like you may have come in contact with somebody that's been infected with COVID-19, be sure to get tested, even if you don't have symptoms. So I'm really here to talk to you about the vaccine. When I saw this picture of Chairman Godwin and Ms. Godwin getting their vaccines, I was very excited. And I hope you all are as well. We are increasing the amount of vaccinations that we're getting from the federal government. I'll talk to you a little bit more about how that allocation takes place. The federal government has actually paid for the vaccine. So it's free to everyone. There's no cost. Now, your healthcare provider may ask you for your insurance, and that's only so they can bill your insurance for what's called an administration fee for giving you the vaccine, but you should not be charged. No one should have to pay anything for the vaccine. But it's important, and I'll say this over and over again, to realize that supplies are limited right now. We only have 2 vaccines that are currently approved for emergency use authorization by the Food and Drug Administration. And until we have more vaccines available, the supply is going to be limited. But I want to tell you, what that process is looking like and where things are going forward. So, as I said before, the 2 vaccines are a Pfizer BioNTech vaccine and a Moderna vaccine. They really have been proven to be safe. They've been proven to be effective. And the best way that we have to slow the spread of COVID-19 and eventually end this pandemic. Our supplies will be increasing, but we want folks to know that you will have an opportunity to get this vaccine. The other thing that folks have questions about is just, how are we utilizing the information that's collected for the vaccine? So, first of all, there's nothing actually in the vaccine itself that can track you. There's no protein in it that can be tracked. The protein that it is in it is really used to just give your body instructions to make the antibodies, and then it disappears. The tracking that actually occurs is the shipments. So we can tell where the shipments are along the way, from the manufacturer to the healthcare provider, and also to assure that those vaccines stay at the proper temperature, that they don't thaw out, in other words, and become inactive. The information that is collected is used by us to be able to provide demographic information about who's getting vaccinated across North Carolina. We update that on a daily basis. But the information that we send to the Centers for Disease Control is de-identified. So all we do is submit the person's year of birth, the first 3 digits of their zip code, and then the date that the vaccine was administered. That's it, nothing else. And one of the reasons why we're very careful about this is because we know there's a lot of mistrust, and justifiably so. When you think about medicine, you think about research, there's been a huge amount of abuse and outright medical violence against people of color. You think about studies that were done, like the Tuskegee syphilis study, other medical research that utilized historically marginalized people, people of color, brown and black people, at their own expense without providing them proper health care. One of the things that we know is that because of this, there's been a lot of work necessary to educate people about how this vaccine was developed so that they can be confident and have trust in its safety as well as its effectiveness. And so we've been really drawn on leaders like yourself to participate in our work groups at DHHS to get insight and to address misconceptions and concerns that people may have. I think it's also important to recognize that while this vaccine was done in a previous federal administration under the term Operation Warp Speed, and that gave people some angst about, where corners going to be cut in this process, there weren't. The vaccines were actually developed, yes, over the course of 9 months, but utilizing research that had been put into place for decades. And in fact, a lot of the work around these vaccines was supported by funding from the federal government to make it go faster, to make it more efficient, to have more scientists and researchers working on this problem around the world. They also shared information about how this process and how these vaccines are developed was actually made publicly available. And scientists, researchers from around the world, including scientists that come from minority communities, actually took a look at that data, studied it, and came to their own conclusions that the vaccines were safe. To the left here is Dr. Kizzmekia Corbett. She is one of the researchers who developed the Moderna vaccine. Her work over the past 6 years really led to that messenger RNA technology, and she's from North Carolina. So a lot of the roots of this vaccine are close to home. Also, there were 10 times more people that volunteered to be in the clinical trials than for typical vaccine trials. Normally, you'd have about 7,000 people in these clinical trials. In the case of the Pfizer and Moderna vaccine, there were over 70,000 people that participated. And again, vaccines were found to prevent COVID-19 and also prevent hospitalizations and deaths. There were no serious safety concerns in the clinical trial. And in fact, CDC still actively monitors the people that are getting the vaccine now. Over 40 million people have gotten the vaccine in the United States to see what their reactions are. And they found very, very few reactions that were more than minor and no deaths thus far. Most of the reactions are temporary, like sore arm or headache or feeling tired or achy for a day or two. Also, it's important to know that for the volunteers, those 70,000 volunteers, there was a concerted effort to get a variety of people participating in the clinical trials. So they had people from different races and ethnicities participating. And this was through clinical trials that occurred around the world. Just a little bit about how the vaccine actually works. So the vaccine has this messenger RNA in it. That's what's in the tube, along with some sugars and some fats and some salts and saline solution. But that messenger RNA, what it does is it has no live COVID, has no dead COVID. There's no virus itself in the vaccine. that messenger RNA actually sends instructions to your body to tell it how to make antibodies for those spike proteins. So if you've ever seen the COVID-19 virus, it's got these little knobs on the end of it. So the messenger RNA teaches the body to make an antibody that sticks to those spike proteins to actually neutralize the virus. So that when your body is vaccinated and it comes in contact with the virus, those antibodies are already made and they can go attack the virus, neutralize it, and you don't end up getting COVID-19. And once the antibodies are developed through that instruction in the messenger RNA, that protein, that RNA actually just disappears. It never gets inside your cell, doesn't change your DNA because it's RNA. It's just an instruction module. So really interesting technology. And as I said before, many organizations that are medical organizations, research organizations that are represented by people of color have independently looked at this research. They've been able to pull it down from the FDA. It's been very transparent, reviewed it themselves and said, yes, we trust the science. And unlike previous research from decades ago, where there were no human subject protections, human subject protections were included very extensively in this process. So the people that were part of the clinical trials were assured and received safe and effective treatment through that vaccine or through the placebo. As I said before, this vaccine, and there's only two right now, the biotech, Pfizer, and the Moderna, they actually require 2 shots. So one shot kind of starts off your immunity, and then that second shot that you get either 3 or 4 weeks later continues to build on that immunity until you get full immunity, probably about 2 weeks after the second dose. But it's important that people get 2 doses. And so to do that, and to remind people and remind providers not only what time to get the second dose, but what type of vaccine, because you don't want to mix it up. We actually built a COVID-19 vaccine management system, or CDMS, to make sure that people get the right dose at the right time. And our goal is really to vaccinate as many people as possible. That's how we're going to be able to end this pandemic. But the limited supply means we've had to prioritize people that are highest risk of exposure to COVID-19, and then also those folks that are at highest risk of sickness or death if they get COVID. We do know right now that demand for the vaccine really exceeds our supply. And what that means is that people may often wait for vaccine appointments. They may be on waiting lists. That will clear up as more supply becomes available. Good news on the horizon, though, is that there is a new vaccine that is being reviewed or will be reviewed by the Food and Drug Administration's Independent Scientific Committee next week, February 26th. That is a vaccine from Johnson & Johnson. It's a single-dose vaccine, so you don't have to come back for that second shot. You only have to run the risk of having those temporary side effects one time versus 2. That clinical trial had over 40,000 volunteers. And the thing that has been shown thus far, and again, the FDA is going to review all of this, is that the Johnson & Johnson vaccine provided complete protection against hospitalization and deaths, and it was over 85% effective in preventing severe disease. And this was across all race and age groups. And same thing with the other vaccines, no significant safety concern and minor side effects, most commonly a slight fever. So as I said before, the vaccine is limited. And so there's some prioritization that needed to take place to make sure that the people at greatest risk had the vaccine first. And those were identified by the Centers for Disease Control Vaccine Advisory Committee as healthcare workers and long-term care staff and residents. That's an active group we're vaccinating right now. And then our second group is older adults, folks over 65 years of age. We developed this in consultation with the North Carolina Institute of Medicine. They convened a vaccine advisory committee to help guide us, and they used the recommendations from the Centers for Disease Control Vaccine Advisory Committee to develop this framework. You'll hear about other states having other prioritization schedules. This is the one that was adopted by North Carolina. We do know that as we're in these Group 1 and Group 2 vaccination phases, Group 3 will begin with people working in childcare all the way through 12th grade. And that's private and public childcare. That will start February 24th. And that's an option for counties to start on that date. If they've not completed at least to 70% of the population of older adults, then they really should be holding back on the teachers until they can get that older adult population vaccinated. Healthcare workers, long-term care staff are getting vaccinated in their facilities. The federal government is actually managing the long-term care program through CVS and Walgreens. And then healthcare workers in institutional settings are getting their vaccine through their employer. So I mentioned February 24th for childcare and schools employees, and that's including cafeteria workers, bus drivers, janitorial staff, anyone that's in that school setting. And then another optional date for opening up to the rest of the essential frontline workers is March 10th. And that would create that. But again, it's going to be important that people in the other groups get vaccinated. Those lines are always open for Group 1 and Group 2. We want to make sure that those high-risk people have that opportunity. And then later on, our two largest groups open up, and that would be adults with high risk for exposure or increased risk of severe illness. And that's 4.1 million people in North Carolina. And then Group 5, which is everyone else, which is about 4.5 million to 6 million people in the state, will round off the vaccines. Now, one of the things I'll also mention is that there are not any vaccines that have been approved for children yet. So all the vaccines are for 16 years of age and older. There are vaccines right now, some of the current ones that are going through clinical trials for children, as well as new vaccines that will be coming to market that have been tested on children. But to date, no children have been vaccinated. So let's take a look at how we're doing thus far in vaccines and vaccine administration. Now, we just started vaccinating mid-December, right? So not yet 2 months, really, well, about 2 months now into it. This chart actually looks at the percentage of people who have received the first dose. So they've started the vaccine immunity process. Once you sign up for that first dose and you get the first dose, the second dose is automatically sent by the federal government to the provider for you. So that dose is there for you. And we've encouraged providers not to use second doses for first dose people. We want to make sure that if you've gotten that first dose, that there is a second dose on the shelf at your provider for you. Now, if you hop around to go different parts of the state or to another healthcare provider in town, they may not have a second dose for you. That second dose is being sent to the provider you got the first dose from. So where are we? 11.3% of the population of North Carolina has gotten the first dose. But the challenge is we've not had representative vaccination by demographics. So when we think about the fact that American Indians have only gotten 4.92% vaccinated, they're not keeping pace with the average for the population of 11.3%. But then we look at Caucasians, they're at 12, white people are at 12.29%. So further ahead of the average in the state. We're working rigorously at DHHS to address those disparities, and I'll talk a little bit about that in a minute. But we've also developed this data at the county level. So let me show you some of the counties in your surrounding area. Let's start with Robeson County. So Robeson County, the percentage of people in Robeson County that have received the first dose is less than North Carolina. It's only 9%. And of the percent of American Indians in Robeson County, only 6.3 have gotten the first dose. And I know that you all are actively involved in developing more vaccination events with your community partners like Robeson Healthcare, like Robeson County Health Department. So I expect that those numbers will go up. And in fact, I'm going to tell you about how we're allocating vaccine to ensure that there will be sufficient vaccine, as our supplies increase, but we're leaning into equity by increasing the amount of doses for communities that have Black and brown people that have been disproportionately impacted by COVID, such as our tribal communities. Let's look at Hope County. Hope County is even further behind. Hope County, 6.8% of Hope County residents have gotten the first dose, and only 2.8% of American Indians, compared to 6.4% of white, 6.5% for Black. And then let's take a look at Scotland County. Now, Scotland County is at 13.1%, which is higher than the state average. But one of the things that you'll see on here is an area where it says data is suppressed or suppressed data. That means that there weren't enough people within that demographic to be able to break the data out beyond just that one grouping. As more people get vaccinated, that suppressed data will be able to be displayed, and you'll be able to see the specifics for African Americans, American Indians, other populations. What we do know, though, is that for white people in Scotland County, they've gotten a disproportionate higher percentage of first dose vaccines than the general population. So this data is on our website. It holds us accountable, and use it as a tool also to measure progress that's happening in your communities. So recognizing the fact that we started out our process in mid-December under the previous administration that essentially said, if states are slow in getting vaccine out and into arms, we're going to penalize you. We're going to take doses away from you on your weekly allocation. And in fact, the previous administration was only allocating vaccine on a weekly basis. So the state never knew really how much it was going to get. What we knew is we were going to get a population, a proportional population, but even that was threatened. So recognizing that speed was a priority, we really focused on having events that could capture a lot of people getting the vaccine. We made sure that there was vaccine available in every county, but that initial process led to a disproportionate amount of vaccines going in the arms of people that had needs, people that had internet access, people that had unlimited cell phone minutes so they could stay on the line, that they could set up appointments in different parts of the state, that they could travel from one county to the other to jump the line of somebody in a community to get a vaccine. We saw that happening. And so when our numbers first came back, there was only it was like 80% of the vaccines went to white people. And the secretary said, now we've got to address the equity issue, because while we've achieved speed, we've not achieved equity. And so what she did was created a process that I'll outline that actually gives extra doses of vaccines to communities that have high numbers, to counties that have high numbers of low income adults over 65 years of age, and counties that have they have high numbers of historically marginalized populations over 65. So Black and brown people, African Americans, American Indians, Hispanic, Latinx. And then for those vaccine events that are being requested by provider organizations, the focus has been on equity. How are you assuring that the vaccines that you're going to distribute, that your location, the community groups that you're partnering with, are going to reach the population so that you're vaccinating people to the level of at least your population? So in other words, if your demographics of your population say that 7%, 10% of your population is American Indian, then you need to be vaccinating at least 10% of your population American Indians or more. We really need to lean heavily into equity because that's the populations that have been impacted the most. And we're holding our vaccinating providers accountable to that. We're measuring them, and we're moving doses on a weekly basis to those providers that are achieving those goals. We want our providers to be working in partnership with communities, with churches, with tribes, with civic organizations that are in Black and Brown communities to host events, to hold open appointment slots, so reserve appointments, to the extent that at least the population exists, to assure that people can get vaccinated, that they're not crowded out by folks that haven't been as impacted by the virus as Black and Brown folks have. We also are putting money into transportation. We're working with community health workers to educate residents and to connect people to vaccine appointments, particularly those that don't have internet access, to be able to utilize their tablet computers to be able to sign up and register people. I talked about the guidance that the Secretary issued to all providers. And then we also are prioritizing federally qualified health centers for vaccines and increasing the amount of vaccines they receive on a weekly basis. And then partnering and scheduling vaccine events with historically Black colleges and universities and historically minority serving institutions such as UNC Pembroke. So this is an overview of how we did the allocations back for the week of February 3rd through 9th. So we know that we've got two separate allocations that come in from different sources that represent the Moderna and the Pfizer vaccine. We give 81% of the vaccine across the counties in a stable amount so that they can plan week to week. We just started getting 3-week allocations from the new administration 3 weeks ago, recognizing that we need to have some steady state for providers to know how to set up and establish clinics. And then from there, what we've done is we established a population amount and then what we call equity bumps, or these HMP/65 density bumps. So in other words, counties that have high numbers of historically marginalized people over age 65 get a bump up, and we allocated that across the counties. Then we have these set-aside amounts for events. And again, these events really need to be prioritizing historically marginalized communities. And so we have set aside 23,000. Over that week, we did 23,000 doses for those events. So much of the focus of our efforts around equity really pertain to how we're allocating doses to community providers and holding them accountable to those demographic administrations. So when we look at getting information out, we developed web resources on yourspotyourshot.nc.gov. We knew that people early on were having a hard time calling into their hospital or their health department or their other providers for appointments. So we created a COVID vaccine help center, one number, one centralized call center to answer questions and connect to appointments. And that number is 1-888-675-4567. We also put some online tools for people to find what group they're in, as well as find where they can locate a vaccinating provider in their state. Here's a screenshot of what those groups look like, what those web pages look like on our website for finding a shot or finding a vaccination group. We also continually update our information, our materials, our videos that are on our website that you can download, that you can print, that you can utilize for community events, for meetings, for sharing information. And we've created a process where you all can actually help us by sharing your story about getting a vaccine. I love the way Chairman Godwin and his wife did that through their photo. You can also upload a video of yourself either giving a testimony about the vaccine or about COVID or about yourself getting the shot. Organize meetings like this. Utilize some of the materials we have. Even this presentation is available online for you to download and use in community and social group meetings. We even have trainings for you to be a vaccinating provider. I mean, not a vaccinating provider, I'm sorry. Be a presenter of this information, we call it a Vaccine 101 presentation. And then we've also put up on our website, actually on this link below, a way where your organization can sign up to actually host a vaccine event, to be partnered with a vaccinating provider to open up your church, your facility, your membership hall to an event where you can cater to your members, where you can say, we want to have a vaccination event and we want to utilize the appointment schedule to get our members and people in our community vaccinated. Until we have sufficient vaccine and until the majority of our population gets vaccinated, we're going to need to continue wearing our face coverings, practicing those 3 W's, waiting 6 feet apart, washing our hands. But the vaccines and our prevention methods are really the best way we're going to be able to get ourselves back to school, back to work, and get our lives back under control. With that, I will take questions that you might have at this time. And I'll end my screen share.
Is there any questions for Deputy Secretary?
Yes, Mr. Money, this is Marshall. I do have a question. In North Carolina, are we still offering only to North Carolinians, or are residents of other states able to come in and get the vaccine?
So the federal government paid for the vaccine. And when we signed up to receive it, we had to sign this, the secretary had to sign this disclaimer that said it's not your vaccine. It's the federal government's vaccine given to you to distribute. You can't bar anyone from any other place in the United States from coming in and getting your vaccine. But what the secretary said you can do, because it wasn't stated in that agreement, is you can restrict your appointments. You can block all your appointments if you want to for folks from North Carolina. You can maybe have some, remaining or extra appointments open for others, but you can have an exclusive event that focuses on your tribal community, your neighborhoods, your zip codes, but legally and technically, you can't stop someone from another state from getting a vaccine. And they, like South Carolina can't stop somebody from North Carolina from getting one, but they can make it challenging just like we can.
Thank you. I just know that I was told that we had Floridians coming all the way from Florida to the Robeson County Health Department to get the vaccine. And then I'm a provider and I have patients that can't get an appointment for a long wait. That was why I asked. Thank you.
Right.
I have a question.
Yes.
2 things. One, when will 65 and less be able to get the shot? And secondly, I keep hearing about vaccines, possibility of going to the bad, and they announce that anybody and everybody can get the shot to keep it from being wasted. How do you know that when an event like that happens? Also?
Those are really good questions. So when we move, so first of all, anyone that's a healthcare provider or works in long-term care facility, regardless of their age, can get a vaccine right now. So that's under 65. But that next group, that essential frontline workers, you're going to have folks that are under 65 in that group. And then the official under 65, just wide open, is that next group, that group 4 for folks that have underlying health conditions. Now, your question about the wasting the vaccine, that's really important because we have a very limited number of doses that we get on a weekly basis. And so we don't want any doses to go to waste. That's why we're really encouraging vaccine providers that are either doing it in their clinic or scheduling events to have a schedule or have a certain amount of scheduled people and walk-ins, but also have a running wait list so that you can call people if you have extra vaccine. If those strategies don't work and you have vaccine left over, then you can't refreeze it. Once it's thawed out, you have to use it. So we want to make sure that anybody, we want to make sure that vaccine doesn't get wasted. We would ask you to prioritize who would get the vaccine. So let's say you were hosting an event and it was in a shopping center and there were 10 people that came along, we'd ask you to say, do you have any folks who are over, 65 years of age? They walk in, let's take them first, right? And then just kind of go down in age order. That's probably the easiest way of doing it. But, if you got somebody, if you have one dose left and the only person that's available is a healthy 22-year-old person, give it to them because we don't want it to go to waste. So that's kind of how that happens. Now, the thing that I've heard is, usually like 10 maybe doses are remaining, 10 or less from an event. I heard of an event that had 300 people and they had 3 doses left. So it's not a huge number of remaining doses. And that's simply because somebody didn't show up or, they got more doses out of the vial. Sometimes that happens as well.
All right.
One more follow-up. If a person gets one of those leftover doses, so to speak, do they automatically get in line for the second dose as well?
That's correct. There'll be a second dose that will follow them to that healthcare provider from the federal government, because that gets put in the system, in that vaccine management system. It automatically triggers that second dose to come in.
Mr. Mo, this is Reginald Watson Dine. I'm an educator, and there are other folks on the council that either work in education or retired educators. And in your presentation, I heard you mention that, educators may be pushed back if the percentage is not complete on February 24th. What's the probability of that, and why would we do that?
So there's a couple reasons why that could happen. Probably the biggest reason right now is if you're near a window, look outside, it's some really bad weather. And that's impacted the transport of vaccines across the country. So we know that the Pfizer vaccine is still sitting, being prepared to be packed and shipped. The Moderna vaccine is packed, but it's still sitting like in a warehouse. Trying to make sure that they don't ship in such a way where they're sitting in a truck and then they expire because the dry ice has evaporated. That means that providers are not going to get their vaccine until later next week. So that's going to back everything up. And if we think about the fact that the earliest that school personnel are getting vaccinated is next week, that could mean that the appointments that were set up for earlier in the week, like let's say the 22nd or the 23rd, would need to take precedence over the ones that were established, because some appointments may get canceled, some may get rescheduled. It all kind of depends on how the provider does their appointment schedule. But the weather is probably the biggest reason why school personnel could be backed up a week. And again, what we've said, what the secretary said in terms of opening up for Group 3 essential workers, school personnel on the 23rd, is that it's an option for counties, because we know that every county is in a different place. Some counties have said, we're kind of done with our over 65. We kind of reached them. We finished our healthcare workers. We're ready to move on. So that would be the opening for them. But we also know that there's some counties, like, for example, the county I'm in, Wake County. There are a lot of healthcare providers in Wake County, a lot of long-term care facilities, a lot of people that are over 65. And so they're behind in terms of vaccinating that age group. They'll probably move into childcare and teachers, but their movement will be a bit slower, most likely. So every county is in a different place. That February 24th is really just a starting point, and it's not a starting point for every county across North Carolina.
All right.
Mr. Speaker.
Mr. Corbett.
Yes, sir. I did have a couple of questions for Mr. Money. Mr. Money, thank you so much for being with us this evening, sir. Thank you for your words regarding disparities in terms of availability and vaccination rates as well. Tells us we've got some work to do. I did have a couple of questions. During your presentation, you mentioned about folks who receive the vaccine, messenger RNA sends over to the body to create those antibodies. But for folks who contract the virus, how long have you seen those antibodies present? Do you have any numbers or opinion as far as that goes?
Yeah, certainly do. So we know that about what we've seen thus far is about after 90 days, the immunity starts to fade. But as long as someone is not symptomatic for COVID, that they've recovered from COVID, they can get the vaccine. That vaccine is still safe for them. But that natural immunity, after about 90 days, it fades away. So we're saying that if you've had COVID, be sure that you either get the COVID vaccine now or you plan to get it, particularly after that 90-day period has passed.
Okay. And then I had one follow-up. For folks, again, with that antibody, do you have any numbers as far as the effectiveness on those new variants that you mentioned? Or is it too early for that?
So the information we have really comes out of the UK that essentially says that because they're using the same vaccines that we are, that the Pfizer, the Moderna, and I don't think they've approved the Johnson & Johnson yet, but I think in their clinical trials for the variants, it's proven to be effective in preventing that UK variant. The jury's still out on the South Africa variant. I know that in South Africa, they were using the AstraZeneca vaccine in a clinical trial. They actually paused the clinical trial because they found that South Africa variant wasn't effective in preventing the contraction of COVID.
Thank you, sir. Thank you, Mr. Speaker.
Okay. Ms. Wendy?
Thank you, Mr. Speaker. Mr. Money, I was asked by an elder to ask, they had heard the rumor that once you get the first shot, if you get the second shot, that the second shot will make you sick. Is that just a rumor or is there any evidence to corroborate that?
Yeah, so that's a really good question. And the side effects that people get, so my wife's a healthcare provider and she got her first vaccine and she had a sore arm, she had headaches, she was feeling pretty lousy. She didn't have a fever, but she just felt kind of lousy for a day and then it subsided. What we hear is that second dose, actually the feelings, you feel worse the second dose. And the reason is when you get that first dose of the vaccine, your body is creating those antibodies. And it's a sign, the side effects are a sign that the vaccine is really working. When you get the vaccine the second time and you create the additional antibodies, you have a stronger reaction, not markedly stronger, but what we're hearing is that people feel a bit worse than they did the first time. And usually, again, those side effects go away in about a day. So I'm not of the age group yet to get the vaccine. I'm short a couple of years. And I don't work directly in healthcare, so I'm not eligible, but I did get the shingles vaccine last year. And shingles vaccine has the same side effects. And both times I felt lousy for a day and then afterwards felt much better. I mean, and I know we all know people that have had COVID. And unfortunately, most of us know people that have died of COVID. The side effects of the vaccine are nowhere near what people experience with COVID, particularly if they've been hospitalized.
All right. Well, Deputy Secretary, let me say I truly, on behalf of our tribal council and the Lumbee Nation for you taking time of your busy schedule and coming in and just giving this valuable information to us, sir. We look for greater things. And again, I express my gratitude for you doing this for us.
Thank you, Mr. Speaker, and I'm happy to come back at any time to give you an update.
Thank you, sir.
Thank you
Take
so
care.
much.
All right.
All right, thank you. Bye-bye now.
Bye-bye. At this time, I will draw our attention to our community comments. I only had one request, and that was from Chairman Godwin. Chairman.
Good evening, Council. Mr. Speaker, Mr. Money, thank you for coming tonight. Just like to start off by saying it's a privilege to be here tonight. I will say to you that my wife and I did take the shot. We had the second one, and what he said, we had the Pfizer. First one, we didn't, our arm was sore for about 36 hours, but on the second one, my wife didn't get this way, but I did, where I just like hit a brick wall, lack of energy, and a low-grade fever and body aches, and that lasted from late evening till the next morning, and it was gone. So yeah, there tends to be some, on that second shot, some side effects. I also would like to point out, if with full federal recognition, everything he's talking about will be controlled by the Lumbee tribal government. Vaccinations, we could do our own vaccinations, record our own numbers, have a bubble over the Lumbee tribe where we know what is going on with our people through these vaccinations and health crises like this, and there will be more. So one day we'll have, this is one of the main reasons why full federal recognition would be important to the Lumbee people, is through healthcare. I would like to point out, for the last few months, I think since July, the Lost Colony Board of Directors, the Lost Colony production in Mania, North Carolina, reached out to us, and they have had a traditional problem of how they're predicting Indians on in their production, and they asked for input. So for the last few months, Kale Little Turtle and Patrick Strickland, we've been working with them. They're going to change their music, their native music. They're going to change their dances, their songs, their wardrobe for American Indians, and depiction of American Indians, even script changes. So this is a major undertaking that they've made a very serious effort on behalf of their board of directors. And this will be the first time ever that American Indians will be hopefully in the show this coming summer. And for the Lumbee tribe, there will be auditions that Patrick's setting up in conjunction with them. Their director will come along with some other people, artistic people from the production of the outdoor drama. And they will be coming to the amphitheater, Lumbee Tribe Culture Center Amphitheater, on March 15th from 2 p.m. until 9 p.m. that evening. People are working. So these are paid positions through the summer. Show starts like late May, goes through mid-August, and they provide housing, all that, out at the Outer Banks and Manio. But I hope a lot of our talent, and we do have a lot of talent that will go out there, and you can go to their website, and the pictures that depict advertising the show for this coming season are Lumbees. They actually came and use some of our Lumbee models, you might say, male and female, and all the pictures you see of American Indians in their PR are Lumbees. The other thing is Fort Fisher. You know, we're going to have waysides there. Karen Bird, along with other of our staff, have been working, primarily Karen Bird, have been working on a display to put at Fort Fisher, talking about the Lumbee experience and participation, forced participation at Fort Fisher during the Civil War. And also they're building onto their museum there. And we've had Kay and some others of our people have been out there and done some collaboration with them as far as our culture and things like that. So they were digging to add on to the museum, and they found another magazine compound under the earth that they didn't know was there. And during the Civil War, they built this fort, and they built it on top of a village, an Indian village. So there's going to be a major archaeological dig, and when that point in time comes, near the end of COVID or whenever that is, They've asked that we be personally involved, the tribe and the Boys and Girls Club. They asked that they specifically come and be involved in that opportunity. And last but not least, if you go to our Lumbee Tribe Facebook page tonight, you'll see a video that was taken by Tasha Oxendine yesterday and some today with our Mark Strickland, our Chief of Security at Lumbee Tribe, and Matt Locklear, who oversaw the dam project on our behalf. But the dam has 3 spillways now, one at the main road you know about, one at the very back, and there's one in the middle. And the one at the back, for the first time in a couple of decades or longer, is functional, and the water is actually going over that spillway back into the river. We don't know exactly how this is going to work. There's an emergency spillway in the middle that hasn't started releasing water yet, but we don't know what's going to happen in the next day or two. I would just let you know that up in the Prospect community in that area, there's streams that come into the mouth of the lake, and that the lake has been dry for almost 2 years now, but this rain has filled it up, and it's showing us that the lake is helping drain water off land in that general area and other areas. But the most important thing is keeping people safe. It's not going to overbreach. It's not going to overtop. Everything's doing what it's supposed to be doing, and we're very proud of that we were able to get this dam finished. And also, I'd caution everyone, there are about 7 roads closed in Robeson County already because of water. We may know of tribal members that may have their properties flooded or their homes flooded, so please be on the lookout for that, and just let the tribal administration know where we need to help if that happens. But I just would like for you all to take a look at that video so you'll see exactly what the dams was built to do. And we're very proud of it and glad that it's keeping people safe tonight. But thank you so much for all you're doing and for giving me this brief time to speak with you.
All right. Thank you, Mr. Chairman. At this time, I'll draw our attention to our committee reports. And the chair would recognize Mr. Dewey McNeil, chairperson of the Federal Recognition. Mr. Dewey.
Good evening. I'm going to read CLLR-02021-0218-01, resolution in support of the Julian Thomas Pierce Memorial Lumbee Recognition Act of 2021. I'm going to start with the fourth whereas Julian Thomas Pierce led efforts to secure full federal recognition for the Lumbee people until his death on March 26, 1988. And whereas the Lumbee Tribal Council recognizes the efforts and sacrifices of Julian Thomas Pierce to secure justice and freedom for the Lumbee people. Therefore, be it resolved, the Tribal Council of the Lumbee Tribe of North Carolina hereby supports the naming of federal legislation to extend full federal recognition to the Lumbee people, the Julian Thomas Pierce Memorial Lumbee Recognition Act of 2021 in honor of Julian Thomas Pierce, the true hero to the Lumbee people.
All right. Thank you, Mr. Dewey. Again, coming from committee, this requires no second. Is there any questions, any discussion? Hearing none. Ms. Belinda, would you do a roll call, please?
Ms. Carveckas Barfield.
Yes.
Ms. Sharon Hunt. Mr. Gerald Goolsby.
Yes.
Mr. Harold Smith.
Yes.
Ms. Pam Hunt.
Yes.
Mr. Ted Waddell.
Yes.
Ms. Wendy Moore.
Yes.
Mr. Carrington Locklear.
Yes.
Mr. Larry Chavis.
Yes.
Mr. Richard Jones.
Yes.
Mr. Reginald Oxendine.
Yes.
Miss Yvonne Dial.
Yes.
Mr. Alvin Mercer.
Yes.
Mr. Corbin Eddings.
Yes.
Mr. Dewey McNeil.
Yes.
Ms. Marshall Locklear.
Yes.
Ms. Chucklewana Oxendine.
Yes.
Mr. Shelley Strickland.
Yes.
Miss Annie Taylor.
Yes.
Mr. Ricky Burnett.
Yes.
Mr. Terry Hunt.
Yes.
Passed.
Miss Belinda. Miss Belinda,
Yes, ma'am.
did you get Miss Sharon's vote? She texted in the chat.
Yes, ma'am.
Okay, thank you.
All right. Thank you, Ms. Belinda. At this time, the chair would recognize Ms. Yvonne Dow, chairperson of Education Committee. Ms. Yvonne?
Yes, Mr. Speaker, and thank you. I will be sharing the CLLR 2021-0218-02. And this is a resolution titled Establishment of the Garrett King Gooseby Educational Scholarship. I will begin with the fifth whereas. Whereas the Tribal Council of the Lumbee Tribe of North Carolina will name a female athlete and a male athlete as the Garrett King Gooseby Scholarship in the amount of $500 for each athlete in the total amount of $1,000. And whereas the Educational, Cultural, and Public Relations Committee of the Tribal Council will establish a committee each year to oversee the process of weighing applications for disbursing funds to applicants, and therefore be it resolved, the Tribal Council of the Lumbee Tribe of North Carolina does hereby support the naming of a female athlete and a male athlete as the Garrett King Gooseby Scholarship in the amount of $500 for each athlete in the total amount of $1,000.
Thank you, Ms. Yvonne. Again, coming from committee, requires no second. Is there any question, any discussion? Hearing none. Ms. Belinda, if you would do a roll call vote, please.
Corvicus Barfield.
Yes.
Sharon Hunt. Mr. Gerald Goolsby.
Abstain.
Mr. Harold Oxendine. No, I'm sorry, Mr. Harold Smith. I'm sorry.
Yes.
Miss Pam Hunt.
Yes.
Mr. Ted Waddell.
Yes.
Miss Wendy Moore.
Yes.
Mr. Carrington Locklear.
Yes.
Mr. Larry Chavis.
Yes.
Mr. Richard Jones.
Yes.
Mr. Reginald Oxendine.
Yes.
Miss Yvonne Dial.
Yes.
Mr. Alvin Mercer.
Yes.
Mr. Corbin Eddings.
Yeah.
Mr. Dewey McNeil.
Yes.
Miss Marshall Locklear.
Yes.
Ms. Chucklewana Oxendine.
Yes.
Mr. Shelley Strickland.
Yes.
Miss Annie Taylor.
Yes.
Mr. Ricky Burnett.
Yes.
Mr. Terry Hunt.
Yes.
And Miss Sharon was a yes. Thank you.
All right. Motion carries. Thank you very much. At this time, I will draw our attention.
I'd just like to thank the council for that and honor my son. Thank you so much.
Thank you, Mr. Gerald. At this time, I'll draw our attention to the calendar review. Is there anything?
Mr. Speaker?
Ms. Pam?
Mr. Speaker, several of, all of the committee chairs spoke, and if it's okay with the rest of the council, what we'd like to do is to get on a regular schedule for meeting each month. That way you'll know. And I can't look at Gerald because my heart's going out to him. But anyway, so I would like to ask for finance to be the first Monday of every month at 6:30.
And this is Marshall. I would like the health committee to be the first Monday after finance.
Mr. Speaker?
Okay, hold on. Finance, first Monday. Health, first Monday. Mr. Terry Hunt.
I'd like the housing to be after healthcare.
Mr. Speaker,
Mr. Dewey?
can I do the second Tuesday of every month?
Yes, sir. If that's what you want. Second Tuesday. Okay. Yes.
Mr. Speaker,
Who's that? Miss Wendy?
I'd like the first Tuesday of each month at 7 p.m.
Okay, Constitution and Ordinance. Okay.
Mr. Speaker?
Mr. Speaker, I was next.
Oh. What?
Mr. Speaker, this is Ted.
Okay, go ahead, Mr. Ted.
I'd like to follow Miss Wendy.
Okay, A and G follow. Okay. Mr. Gerald, I heard you.
Yes, sir. Maybe the first Thursday at whatever time is available for economic.
All right.
Mr. Chair.
Was that Miss Yvonne?
Yes, it is. I would like the second Monday at 7 o'clock.
Okay, Miss Yvonne, education. Okay, it's 7 o'clock. Okay. Anyone else?
Mr. Speaker.
Mr. Corbin?
Yes, sir. I'll take the second Tuesday right after federal recognition for ethics. And then also, if we could, if there aren't any more committee meetings, I would just like to draw everyone's attention back to February. As a reminder, February 23rd, 6 o'clock, which is next Tuesday, Ethics Committee meeting. If you would, please look over CLLO 2010 031201, just to get yourself somewhat familiar with it. We're going to begin back working on that ordinance as far as an amendment goes. Thank you.
All right.
Mr. Corbin, when did you said you wanted the second Tuesday?
Yes, I think Mr. Dewey mentioned federal recognition on that second Tuesday, and I'll follow that. And if I would, could I say something else if you don't mind, Mr. Speaker?
Yes, sir.
We may want to look because from what I wrote down, it looks like we did do 5 different nights of meetings. We may want to just get back together at a later time. I know I don't want to delay the matter, but I don't know if we want to do five nights, 2 weeks straight. We may want to do some consolidation on that moving forward. But anyway, I just wanted to bring that to our attention.
All right. Thank you, sir.
Mr. Chair.
Miss Yvonne?
How many people have meetings for the second Tuesday?
Right now you have Constitution, Ordinance, and Agricultural Natural Resources. You have 2.
2?
Yes, ma'am.
2. I think I would prefer the second Tuesday instead of the second Tuesday instead of the second Monday.
Okay. All right. So we'll change education to the second Tuesday.
But what time? What times are available?
Miss Wendy's starting at 7 o'clock.
No, federal recognition starts on the second Tuesday at
Mine's
6 o'clock.
the first. Mine's the first Tuesday.
Yeah, first Tuesday.
Okay, well, I'll take at 7 o'clock then on the second Tuesday instead of on Monday.
6 o'clock is available on the first Tuesday.
Yeah.
Say 6 o'clock is the only one available?
Know what you got?
First Tuesday.
Okay. Let me draw your attention. CNO's at 7 o'clock. A&G is to follow after that on the first Tuesday. On the second Tuesday, Miss Yvonne, you have federal recognition, which is first, which is 6 o'clock, Mr. Dory?
Yeah, that's right.
Okay, and you got ethics following that, which would be 7 o'clock. And then education could be at 8 o'clock, Miss Yvonne.
Okay, that'll be fine. Thank you.
Okay. All right. Is there anything else for the calendar? So let me make sure Miss Belinda's recording this down. Finance, Health, and Housing will be the first Monday of every month. First Tuesday of every month will be C&O and Agricultural Natural Resources. The first Thursday of every month will be Economic Development. The second Tuesday of every month will be Federal Recognition, Ethics, and Education. All right. With that being said,
Mr. Speaker. This is
Mr. Corbin?
Yes, sir. I apologize. I did have a couple announcements I did want to mention. We do again have I know we said it earlier, but just as a reminder, so we let folks know, The Robinson Healthcare Corporation and the tribe are working together to do the COVID vaccines this Friday. Next Friday from 9 to 3. And in March, the Indian Unity Conference is going to be the 11th through the 12th. That is virtual. Registration is open now, so you can go to united-tribes.org to register for that. And then also UNCP has a conference on the 25th and 26th in coordination with Arizona. We Still Remain is the title of that conference. Registration is free on that. And of course, you can find that on the tribe's website or on the tribe's Facebook.
Right. Thank you, sir. With that, I will entertain a motion to adjourn.
Mr. Speaker, this is Marshall. I would like to make a motion to adjourn.
Mr. Speaker, I'll second.
Moved by Dr. Marshall to adjourn, second by Mr. Terry Hunt. At this time, I'm going to ask Mr. Terry, if you would, to close us in a word of prayer.
Let us pray. Dear Heavenly Father, we come to you again, dear Lord, thanking, honoring you, and praising you, dear Lord. We thank you for your love and your mercy and your grace, dear Lord, that you bestowed on each and every one of us. Dear Lord, as we continue to go through this night, we ask you to continue to be with us, help us, and guide us. Be with those that are sick this evening. Be with Sharon, dear Lord. Help her and guide her through this sickness that she's had. Dear Lord, and we just ask you to protect us all and look after us. Dear Lord, we thank you for Brother Gerald and his family in order to make things better for young students, dear Lord, that they can strive to make their lives better. And we thank them, dear Lord, and we thank you for being able for them to provide. Dear Lord, remember our tribe, just not only our tribe, but remember our nation. Dear Lord, that we will always keep you first in anything, in any decision that we make. Dear Lord, we just thank you and we love you. And we ask these things in your name, I do pray. Amen.
Amen. Thank you, guys. Be safe.
Take care.